So Dr. Periman, let's talk about maybe some pearls for practices that are sitting on the fence for point of care testing within their practices and how we could maybe offer them some suggestions to be super successful with this. So what would you say would be your number one pearl to help somebody that was totally new to this get it going?
Oh, my number one pearl, I think understanding the critical import of inflammation, right? You have to measure what's actually happening. You can't look at an eye and predict the level of MMP9. You have to measure it. So that's probably my number one pearl. You got to know what you're treating. You got to know how severe things are. And that actually helps to guide me in my therapeutic offerings. If it's really brightly positive, I'm layering on more therapy rather than less, which helps get control of the situation faster.
So for me as a non-clinician, I look at it as my job is to make things as simple as possible for not only my physicians, but for my team. And sometimes the physician perspective, such as yours, seems more complex to the average staff. And so, what I want to do is kind of break it down and make it super, super simple. So for us, when we first looked at MMP9, it was like a light bulb going off for me. If I ask 3 of my physicians in my office with this patient does this patient have inflammation? I may get 3 different answers. And there's actually 3 different answers, right? But if I have a test in place where a technician is taught super early what to trigger her to get this diagnostic in place for my physician, then it makes the physician's job super simple because it's delivered to them on a little platter, right? And they can then from there, their job is to do treatment from there.
I love that strategy, and I think you're completely right. Make it super simple, because what it ends up doing is creating the building blocks that the clinician then needs to accurately diagnose and effectively treat, layering on things that are indicated in that individual situation. But I love how your team is set up to facilitate that information gathering, that critical data capture that we then base clinical decision making on.
Yeah, so in our practice, what we do is we do a speed. If the speed is above 0, and that's a super low threshold for us, but my perspective is a 1 means there's a sign or a symptom going on, right? So if there's a 1, the technician now knows that if Dr. Periman's their doctor for the day, they're going to go ahead and perform an MMP9 point of care testing, and she's going to get the results, and then we're going to go into treatment mode for the patient. For us, it is such an educational process for even the technician to be able to show this test to the patient, to be able to use it as an educational tool and explain that with dry eye disease and signs and symptoms, sometimes even the patient might not realize everything that's going on, and inflammation is one of those things.
And there's some unexpected benefits from that approach as well. You're starting to create that conversation with the patient. You get engagement from your staff. That communication is starting there, and so by the time the doctor comes in to see the patient, the idea's already been discussed, the level of severity has been demonstrated, and now the patient is much more engaged in the process. And I think that translates into adherence to therapy and better outcomes.
Super early for us, our teams used some of the teams from Quidel, and they came in and we did them on each other. We figured out where we were going to position them in the office so that they were easily accessible to the techs. Because what you'll find out sometimes with the technicians, if they've got to run all over the office to get something, then they may not do that. They may find an excuse or a reason to shortcut it. And then when you as the physician get the patient in front of you, you don't have that diagnostic in front of you that you can use. The other thing with InflammaDry is that it's such an educational tool. And to be able to show that patient is so powerful. Instead of you just saying, gosh, I looked at your eye and I see inflammation, that patient's going to go home and look in the mirror and say, well, what did she see? Because I don't see it, yes. Right? And with this test, it kind of takes the question off the map, I think.
It's a powerful communication tool. I totally agree. That picture's worth 1,000 words, right? And you've got the result right in front of you.
So on the pearls, think about ease of use, ease of accessibility for your technicians and for your physicians. Think about the fact that you need an interpretation within your record so it's documented clearly for billing and compliance purposes. And think about the inventory process of it, because the last thing you want to do is run out. You want to make sure you keep them in supply.